New at noon, the FDA is expanding who can get a COVID-19 booster shot as the Omicron variant continues to surge across the country. Just a few hours ago, the agency approved boosters for 12 to 15-year-olds. The extra dose was already eligible for everyone 16 and older. Now, the FDA also says people can get a booster shot as early as 5 months after their last dose rather than 6 months. But you won't be able to sign your teen up for the booster just yet. The CDC still needs to give it the green light. And today, members of the National Guard will arrive at hospitals in Indiana like Eskenazi Hospital to provide support to doctors and nurses. Now, we know healthcare workers are simply exhausted, and they need all the help they can get to deal with this COVID-19 surge. So right now, hospitals, including Eskenazi, are short-staffed, and those on the front lines are getting sick themselves. Staff are developing breakthrough infections, testing positive with this, again, highly contagious Omicron variant. Dr. Graham Carlos, an ICU doctor at Eskenazi, who's also the executive medical director, says more sick patients are filling ICU beds, causing a strain on the hospital system. He says this time it's different than the first go-around in 2020.
I'm receiving calls from all over Indiana, including some from Kentucky and Illinois, asking, begging for us to take patients in critical care transfer because there's simply no beds, no access to critical care. And I find myself saying, I'm so sorry. I wish we could help you, but we are simply out of that resource right now. The best we can do is offer you a wait list, and they still take it.
Yeah, it's definitely tough to hear. Heartbreaking situation going on there. Dr. Carlos said they just put 2 more COVID positive patients on ventilators at Eskenazi. That was on New Year's Eve, and 13 of the 20 patients he saw had respiratory failure from COVID-19. Reasons why he and other doctors urge all Hoosiers to get vaccinated. Well, Pike Township students are spending their first day back from winter break at home. This morning, the district announced it would be an e-learning day because of so many absences in the transportation department. Now, this isn't the first time this year that bus issues have kept students at home. So far, we haven't heard what the school is planning to do tomorrow. Well, millions of kids are headed back to school as COVID-19 cases surge. It has a lot of parents wondering what's best for their families. Britt Conway has the latest from health experts and education officials.
Omicron is so much more contagious than the previous variants have been.
And it's hitting kids harder than the previous variants. Child COVID-19 hospital admissions have hit an all-time high.
I think a lot of the safeguards that people had in place before had been lost. So many kids getting infected, and when the sheer numbers go up, that percent unfortunately starts to get more of our kids put into the hospital.
Health experts expect it will only get worse. So what does that mean for sending kids back to school? Depends on who you ask.
We can keep our students safe, and we can keep them in person together learning.
We really want our kids in school. So if we're talking about a 1 to 2 week delay to try to get past the peak of this, I think that's reasonable.
Trying to open schools at this point, it's hard to imagine how things will go well, especially if you start seeing absences of school teachers, bus drivers, cafeteria staff. That's all going to feed into this.
How the return to school is being handled depends on the district and sometimes the school, but the advice is the same.
Talk to your officials at the schools. Be sure that everyone there is wearing masks if possible. Talk to them about keeping the doors and the windows open.
We know that wearing masks works. We know that distancing when possible works. We know that hand washing and ventilation, all of those things work.
If your kids are 5 and up, vaccinate them.
You don't want to be the parent whose child doesn't do very well and ends up in the hospital.
I'm Britt Conway reporting.
Well, last week, Indiana health leaders outlined school quarantine changes for students. Now, with some classes resuming later today, these are rules every parent needs to know. Basically, staying in class comes down to making sure kids wear their masks and that they're fully vaccinated against COVID. Of course, we have the new rules posted for you right now at WTHR.com and